When I heard the diagnosis, which I'll always remember was the Monday before Thanksgiving, I got the phone call and my provider told me right away within 2 sentences, "I'm sorry to have to tell you, you have cancer and the treatment is mastectomy." My name is Simone St. Laurent and I'm 52 years old. I'm a proud lesbian, married to the love of my life, Allison Michael Ornstein, and we live in Brooklyn, New York. I'm grateful in retrospect that I heard the worst news right away, but it was very shocking and unexpected. I consider myself a healthy person. I do everything I can to take care of my health. And the second thought I had was I'm going to die, and the third thought was how am I going to tell my wife this news? After my diagnosis of stage 0 breast cancer, I have DCIS. My doctor told me time was of the essence, especially receiving this diagnosis of stage 0 before it could spread, before it could get out of the milk ducts. Subsequently, through biopsies, we discovered that I actually have the most virulent form of it and most likely to become invasive, and that helped me decide to move forward with the standard treatment. After finding out I needed a mastectomy, then immediately you're told you need to reconstruct, and in all the doctor's offices it was immediately assumed I would get implants. And that was shocking because there was no discussion. I don't want a foreign object in my body, so I knew I didn't want implants. So then I was told, well, you can do reconstruction with your own tissue. In my own research online, I discovered aesthetic flat closure, and I asked the cosmetic surgeons about it. And of course I could choose that, but it's not the direction most doctors pointed me in. But I'll tell you, the thing that helped me the most was reaching out and speaking to people in the LGBTQIA community. What did they do and what did they think? And interestingly, my trans friends helped me a lot because there's top surgery in the trans community. I was able to get a lot of support and help from those friends. I was also able to get a lot of help from other people who've experienced this. Informally, I would talk to a friend and they would say, I know somebody who had this, you should talk to them. And I must have spoken to 15 or 20 people in the 2 weeks I had to make a decision. I also felt influenced by my wife and my friends and family. I will say that my cosmetic surgeon's office was incredible. They answered every question I had. I could email them day or night. I could do video Zoom conference with them. I could ask them to see pictures of results. That was so helpful. I felt that I had a lot of access to information, but the ultimate decision had to be mine. And that's the hardest part, you know? It's interesting to consider not replacing a body part that you're very familiar with and that defines your gender in our culture. I used to say to my wife, you know, maybe I am a trans man. Maybe I should have top surgery. I've never really had a great relationship with my breasts. So I was shocked to find how important they were to me. And when I was faced with the idea of reconstruction and thinking about aesthetic flat closure, which is a shorter recovery and would be certainly easier to go through, I was surprised to find out that it was important to me to have reconstruction. So that was something really surprising for me as a lesbian and a female-identified person, that I always thought I understood my trans friends, and I realized that breast reconstruction was important for me to affirm my gender. Throughout that process, I didn't specifically identify that I am a lesbian. My queer identity had to be identified throughout the process by me referring to my wife. It was never asked of me, and I think that's something that could be implemented if intake forms asked more specific questions. What's your gender identity? What is your sexual orientation? How do you prefer to be addressed? What pronouns do you use? It's a courtesy of providing a gown color that's not pink. How about just another neutral, non-genderized color? How about offering me a support group when it doesn't have the title of a women's support group? How about it just being a support group? And I think it would be amazing if providers and doctors thought about that. We are all of you. We are the same. And we all want to be treated with humanity, and we want to be treated with empathy. And so when you think about it from a policymaker or legislative point of view, we're everywhere. We are your relatives. We are your siblings. We are your colleagues. We are in Congress with you. We are the firefighter who comes to your house. We're the nurse who takes care of you. And so how would you treat yourself? Well, then that's the kind of policy you should implement for our community. Facing difficult situations gives me the opportunity to find out about qualities I had no idea I had. I didn't know I could persevere. I didn't know I had the strength to go through this. I didn't know I had this integrity to show up, do the treatment I needed to become healthy again, and then I can speak and advocate for my community. I can be a voice that says we need to change things and that we're worth it. And we're worth it to survive so that we can share this message and help generations to come.